A commonly prescribed diabetes medication has now become popular for its weight loss effects. It's called Ozempic, but many are concerned about the long-term effects of the drug if the patient is not diabetic. I spoke with the director at the Center of Weight Management at Desert Regional, nurse practitioner Rachel Millard. Rachel, there's a lot of talk right now about some of these new weight loss drugs. Tell us about some of the hype and also the hazards.
Well, Peter, it's really exciting to be in the field of obesity medicine right now because we're really shining a light on new research that's coming out, new technology, new medications. We've been using these medications for a while, but what's great about them is they have a lot of benefits to the whole body. You know, we know obesity is a disease, it's systemic, it affects the whole body. These new medications, Ozempic, Wegovy, Mounjaro, they're all part of a group of injectables that work on the actual appetite hormones and proteins that our body already uses.
So are these drugs effective? And if people want to lose weight, should they use them?
So we definitely have never seen anything like this on the market before. Some of these medications for weight loss are showing 15 to 20%, if not more, weight loss for patients. And it's important to know that they're very similar. A lot of them are used for diabetes as well, hence Ozempic, Wegovy. That's where a lot of the sensationalism has come from, is that there's been some stock issues, patients using them that aren't appropriate. And FDA recommendations is somebody needs to have a BMI over 27. We use, height and weight to calculate that BMI, and they have to have comorbid conditions. So something medically related to weight loss, or to have a BMI over 30. So somebody that needs to lose 5 pounds, these really aren't appropriate for. And in fact, they may just get worse side effects of nausea and sometimes some vomiting.
I was going to ask you about the side effects. What are the dangers that people need to know about?
Overall, we used to use a lot of stimulants, and we still can for weight loss, like phentermine. But these new medications have such a good safety profile. They don't interact with a lot of medications. We don't see quite the same responses in the heart rate and the blood pressure and the anxiety. But because they're working on the appetite and the gut, it's all GI related usually. So sometimes some nausea, sometimes some constipation. But I tell you, if patients can get through it, those that need the medications, it's worth it for them after that first few months.
It almost seems like this is a miracle drug.
I think it's more of a miracle that we're finally looking at obesity as the disease that it is versus just a personal failure, because it's not. And weight loss is very complicated. And it's not just, eat less, exercise more. I think the miracle is that we're actually targeting specific processes in our body and tackling the biological components of weight.
And I know you mentioned these drugs should go to people who really need them, who are not just a little overweight, but very overweight. But I'm hearing and I'm seeing a lot of reports that Hollywood celebrities and a lot of people are using these drugs to lose 5 to 10 to 15 pounds. So is it easy to get this type of prescription? And what do you think about that a lot of people are using this drug when maybe they shouldn't be?
I think it's a little misguided, because something to keep in mind is obesity is a chronic, relapsing, progressive disease. If you stop the medication, that 5 or 10 pounds is going to come back, because it's setting an off balance that's already going on in your body, and it's fixing that. So if you take that away, so is it really worth for 5 pounds weight loss to be on a medication forever? No, it's not. And there is a stock and a supply issue right now with the medication. So that's unfortunate. Patients that need them can't always get them.
And that's an important point, because this is, like you said, a diabetes drug. So if people are using this drug to lose weight, is that taking the drug away from people who actually depend on this for their diabetes?
It's kind of a complicated, ongoing issue, because about 80% of people that have diabetes also suffer from obesity. And so a lot of times those conditions go hand in hand. But one of the medications is approved for diabetes. One of them is for weight loss. They're the same medication. Sometimes insurers will only pay for the diabetes, but they are not as up to date on paying for medications for people that have obesity. So that's kind of where a lot of the supply issue comes in as well, is these patients really need it, but they're seen more as a they should be able to do it on their own, which we would never expect somebody with diabetes that's advanced to just manage themselves.
Anything else, Rachel, you would like to say about all this? And if people would like more information, I know a lot of people are hoping to go on to these drugs. What do they need to do to get more information other than just talk to their doctor?
Yes, I think talk to your doctor. You can always come see us at the Center for Weight Management at Desert Care Network, and there's information on our website for that. And I think it's just good to start having these discussions, have them with your doctor, have them with your friends, and let's bring obesity and weight and make it more acceptable to talk about.
All right, Rachel, we appreciate your time. Thanks so much for joining us.
Thanks, Peter.